recording start now, or do we have a moment when it's supposed to start? Or
I think Allison will, Melissa, correct me if I'm wrong. I think Allison will start it as soon as you and the judge say the meeting is started.
Okay.
Correct.
So I'll be running the first half of the meeting, chairing it, and then Judge Baldini will do the second half. So I think that will be the most efficient. So I will. Okay. So if everybody's ready here to rock and roll, that would be great. All right, Allison, when you're ready. All right, so welcome to the meeting of the Connecticut Advisory Council for Victims of Crime. We are here on Tuesday, February the 8th, and I'm Susan O'Million, one of the co-chairs of the council. I want to welcome people here, members here. So we have a very full agenda, so when I get started, what we're going to do is do some quick run around the circle here, the team circle, to introduce ourselves. And I will start, and I think what I'm going to do is call on people as best I can, and then we'll just run it as quick as we can. So we've got a very full agenda. So I will start. Susan O'Million. I am a survivor of homicide. I sit on the council for a number of years, and I'm also an attorney working with domestic violence victims. So Debbie, do you want to go? You're on mute.
There we go.
Yeah.
Sorry. Debbie Whitkin, the Executive Director of Connecticut Legal Services. Good afternoon, everyone.
And Linda Cimino.
Good afternoon, Linda Cimino, Office of Victim Services.
And Linda Blosey.
Hi, everybody. Linda Blosey, Director of Training and Prevention at the Connecticut Coalition Against Domestic Violence.
And Jim Morgan.
Good afternoon, Jim Morgan, Program Manager at the Office of Victim Services.
And Judge Baldini.
Good afternoon, everyone. Laura Baldini, Superior Court Judge.
Here somewhere.
Great. And Andrew.
Andrew Woods, Executive Director of Hartford Communities That Care.
Jean.
Hello, everyone. Jean Weisbrod. I provide administrative support for the council.
Okay. And let's see, Allison, Melissa.
Hi, everyone. I'm Melissa Farley. I'm the Executive Director of the External Affairs for the Judicial Branch, and I hope everyone's doing well this afternoon.
Thanks. Mary.
Good afternoon, Mary Kazicki, Deputy Director, Office of Victim Services.
Great, Mary. Good to see you. Let's see, Patrick.
Hello, good afternoon. Sorry, I'm getting another call at the same time. But Patrick Madden, President of Market Decisions Research, lead on the statewide victims needs assessment that's currently being conducted.
Great, thanks. And Adam is here too, Patrick.
Yep.
Great.
Adam Johnson, Project Manager for MDR and working on the statewide victims needs assessment.
Great. And Amy?
Hello, Amy Lupoli, Senior Director of Clinical Services at Klingberg Family Centers.
Great. And Gail?
Good afternoon, Gail Hardy at the Office of the Chief State's Attorney.
Great, thanks. And Michelle, I think Michelle's sitting in for Bob.
Hi, I'm here. Michelle Lettieri, Mothers Against Drunk Driving, Director of Victim Services. Bob is out today.
Great, thanks. All right, did I miss anybody? I think Irene. Irene?
Hello, everyone. This is Irene Michael, and I'm a commissioner with the Office of Victim Services.
Great. Okay, did I miss anybody? I think it's everybody I can see.
There's
another. Hi there,
Susan. I'm from Market Decisions, and I'm also working on the project of the needs assessment.
Oh, great. Okay.
Hi there. This is Jessica Pisano. I'm the Director of Victim Services with Survivors of Homicide. It's good to see everyone.
Thanks, Jessica. You told me that you were there, and then I forgot, so I appreciate that. Okay, I think we're around the circle. That was very efficient.
Susan,
thank you. Yes.
Ebony's here.
Oh, great.
Well, is that
Ebony.
here? No, sorry, never mind, I'm wrong.
Okay. All right. Okay, so what we're going to do, since we have a quorum, is we're going to look at the minutes for the November 8th, November 9th, 2021 meeting. They were sent out ahead of time by Jeannie for all of us to take a look at. So if I'm looking for a motion to approve them as presented.
So moved. This is Debbie Whitkin.
Okay, Debbie's good. Is there a second?
Second, Amy Lupoli.
Okay. And any discussion? Any changes or, all right. And all those who approve, say aye, or otherwise indicate by whatever, raising your hand or.
Aye.
All right. Is anyone opposed? All right. So it's been moved and seconded and approved the minutes. That's great. All right, and we have 3 presentations. We're gonna and I think all of them, a number of things were sent to you ahead of time, including the PowerPoints for these presentations. So we'll also be showing them on the screen, but just so you know, you have that material on the one of the last emails that Jeannie sent out to all of us for this meeting. So we're going to start with the report on the OVS victimization needs assessment. Patrick's going to present, and most of you who've been on this at these meetings know we've been working on this for a while. So it's an update, and the material was also in your packet. So when you're ready, Patrick, go for it.
Sure. Adam, did you want to take the update today, or did you want me to handle it?
Yeah, I'll kick things off at the very least.
Sure.
Okay, great.
So let's see here. If we can get the slides up. Are you able to maybe share your screen, Patrick? I think I'm not listed as a presenter.
I could probably handle that. Second here. All right.
So good afternoon, everyone. As I mentioned, my name is Adam Johnson. I've been working as the project manager for the Connecticut Victims Needs Assessment. Happy today to give a brief update with my fellow team members, Allison Tippery and Patrick Madden at MDR. So first, just to give a brief update on the overall status of the Connecticut Victims Needs Assessment. As of the end of 2021, we've wrapped up data collection with our online quantitative survey, began working through the analysis and reporting phase. We've completed an initial draft summary report of our results from that survey, and we've been working through the revision process with Linda and Mary over at OBS. We were also able to schedule and complete, I think, 39 in-depth interviews with survey respondents who indicated a willingness to share more about their experiences. My associate, Ms. Tippery, will be providing a brief update shortly on that process as part of this presentation. We finished compiling the results of those interviews and are actively working on the report for that piece as well. Our current focus is the third stage of data collection. So this is talking with providers of services to gain insight on their experiences on that side of these interactions. We're drafting a moderator's guide and setting up our recruitment tool, and we'll be recruiting participants from a broad array of service providers to complete focus groups through this month and into the next. Our goal is to complete 6 virtual focus groups among providers in locations across the state of Connecticut. Once this final phase of data collection is complete, we'll be pulling together the findings from all 3 of these data collection phases into a cumulative document that will reflect all aspects of the research that we've been doing. But we do have some preliminary data for the quantitative survey, though, that I'd be happy to present to you all today. So that first part of the project that I mentioned was a quantitative online survey. We administered this to residents of Connecticut across the state who reported being the victim of a crime. We completed 1,237 surveys across the period of the end of August 2021 through mid-November. As I think presented last time to this council, the people that we spoke to with the survey matched closely with the overall demographics of Connecticut. And of those, 53% of those we talked with reported being the direct or indirect victim of a violent crime, as we categorized through conversations with OVS. So I've provided some examples of what we defined as a violent crime on this slide. These are things like domestic abuse, physical assault, sexual assault or childhood sexual abuse, robbery, homicide, gun violence, crimes of this type of nature. We will have, of course, a larger, more thorough breakdown in the final report. Next slide, please. Of those who did experience violent crimes, a third reported repeated or ongoing victimization, and over half of these crimes were committed by someone known to the victim. About a quarter of violent crime victims also reported not telling anyone about their victimization. The reasons behind this lack of reporting were varied. Things like fear or shame, belief that nothing would change. There are a couple of others that we found out sort of also listed on this slide that you all should have access to as well. 2/3 of those who experienced a violent crime also reported a negative impact on their mental health, and 3/4 of those who reported being the victim of a violent crime reported not receiving one or more needed services. The most common needed services reported not being received mental health services, information about other resources, or help with the criminal justice process. So some final top line takeaways that I'm happy to share in advance with this council. Many victims don't report the crimes that they experience due to those feelings of fear, embarrassment, stigma, or because they don't think it will change anything. Lack of knowledge about services available was the most common reported barrier for not getting needed services. Other barriers include feelings of hopelessness, fear, depression, embarrassment, or stigma, those sort of negative mental health effects. Children are, of course, a particularly vulnerable population. Victims of child abuse were the most likely group to say that they were not aware or told of the services available to get help. Mental health issues were the most common problem experienced as a result of victimization. Finances, work and school issues, relationships and housing were also common issues, but not as common as mental health. One thing that was reported as helpful was having a trusted person to rely on. These would be counselors, friends or family members, or social workers who are able to provide needed support and help connect victims with those services that they might need. So this is sort of some of our initial findings for that quantitative survey. Now I will hand things over to Allison, who can talk more about the IDIs that we have completed.
Thank you, Adam. And hi, everyone. I'm Allison again, and I'm also a project manager at MDR. And I also work on a lot of the qualitative research projects, including focus groups and in-depth interviews. So I am lucky enough to work on this particular project. And as Adam mentioned, we are officially done with the interviews themselves. We have a total of 39 total interviews. And I think he mentioned earlier too, for those of you who don't know, the way we recruited for these participants was through the survey. So we had a final question at the end of the survey asking if participants were interested in sharing more of their story and their crime experience. And if they clicked yes, they were given a chance to share their email and or telephone number. So that's how we had our sample for the interviews. We started with an email invitation first. We wanted to make it as easy as possible for them as well. So we included a bookings link where they could simply go to a link and schedule an interview for a time and day that worked for them that was connected to our calendars. And that worked very well. And then those who did not have an email, we ended up trying to call them. And those who we did not hear from through email, we did call them as well. We had an original goal of 50 interviews. Those from the survey that were interested ended up only being about 220 participants. So it was a small sample, but we are actually very happy with the 39 interviews. They were very good quality, and there's only so many times you should reach out to people, especially on such a sensitive topic. We did start at the end of October, ended January 14th. That was a longer period than we planned, but we wanted to make sure, especially around the holidays, that anyone who was too busy then still had an opportunity to do an interview. The actual interview guide itself, what we asked the participants, there were a few different sections. We asked about, of course, their initial crime experience, what they did right after the crime. We talked about services they received, what was helpful, what wasn't helpful, services they didn't receive that could have been useful. We talked about barriers to services, challenges such as mental health, going back to normal life, and financial challenges. And then we ended the interview with opportunities for improving victim services in Connecticut. We also had the chance to look at initial data mid-collection from the survey and add some appropriate questions to the interview guide. So we are in analysis and reporting stage. We have all recordings transcribed and de-identified and have been diving deeper into the actual data. And so these are some initial key findings that are really sticking out. So the first one, and it might seem familiar from a top line from a previous meeting, but this continued to be true throughout the interviews. So interviewees report polarized interaction with law enforcement. So they either had a great experience with police or they had an awful experience with police. We see this pattern with the interviewees that those who experience more violent crimes are more likely to report that they were unsatisfied with the police. There were also some interviewees that were very passionate about brainstorming new ways to eliminate conflict between law enforcement and the people. Another key finding is almost every participant, whether it was a violent or nonviolent crime, struggled going back to work or school after their crime experience. And these types of struggles they mention are poor mental health, difficulty focusing, whether it's due to paranoia, trauma, distraction, etc. And many people mentioned just the fear of losing their job if they had to take extra time off, or the fear of being transparent with their employer that something was going wrong or differently in their life. Some mentioned that they would have liked more resources or known about resources that could help them transition back to work. Third key finding, many participants were also passionate about the need for victim services to be more accessible and advertised. A lot of people had different ideas. Some of those common ideas were expanding social media and internet methods, whether those are advertisements or the actual resources themselves. People said they wish they could Google things easily and things would just pop up. People mentioned how COVID-19 has obviously caused a lot of things to go more online and that they wish they knew, or that there was more opportunity to do things like police reports or court paperwork, those types of things on the internet. They also bring up ideas such as better service provider training in regards to their knowledge about services. And this is with law enforcement or social workers or whoever they're interacting with right after the crime. Many people mention they wish that whoever those people are, that they had more knowledge about the services themselves. They also mentioned things like more immediate resources offered to victims. And an interesting one was wanting more ways to collaborate with the victim's family and/or support system from the beginning. And another key finding, which is maybe not surprising, but participants that received mental health services after their crime usually report a positive experience and express that their coping skills for their life after the crime are better. And this I won't go through in depth, but it's for everyone to see the breakdown of each interview and some demographics. And that's it on my end.
Thank you much,
Yeah, and I
Alex.
think this will be, Ali, you can follow up. I think this will be shared as part of the reporting methods report as well. So again, it goes to show you that I think even with 39 interviews, we've really tried to get a wide range of experiences, both in terms of the types of crimes that were experienced, as well as the demographics of the individual participants as well.
So the next stage of this is, of course, those provider support or focus groups that I mentioned at the start of this presentation. So the purpose of these is for gleaning service site insight into the services victims currently use, need, and are unable to receive. We want to understand what challenges providers face in meeting the victims' needs, as well as opportunities for improvement. We're intending to focus on underserved communities, but with a wide range of providers. We're drawing the line around what is a service provider fairly broadly, including organizations such as law enforcement, legal services, advocacy, healthcare, mental health services, social services, community outreach, really to provide the most facets of input on this issue as possible. We are intending to reach out to groups both through the OVS network, as well as doing some direct outreach by internal market decision staff. We'll be screening both through phone and an online instrument as we begin to spin up the recruitment process. While originally these groups were proposed as in-person focus groups, we of course recognize with the larger COVID-19 pandemic that a online group is a bit more feasible and safe due to the current situation. We've had some good experiences in previous online focus group recruitments with respondents reporting that not only was it more convenient to them, but it made it more accessible overall. So we're fairly hopeful that these will be full and successful groups. We will, of course, include the results from these focus groups in the cumulative needs assessment report that we'll be compiling in the month of April. So that brings us to the end of this needs assessment update. Before we draw things to a close, does anyone have any questions, either for myself or Patrick or Ali?
Hi, this is Amy Luplik from Klingberg Family Centers. I was just curious, and I know you commented on the demographics and the populations of the victims that gave a more in-depth interviews. What were the attempts to create a more diverse, as 29 of them were identified as white and Caucasian, about how crimes, what was kind of the process to try to encourage and support other races and ethnicities to participate in that?
Yeah, that's a great question. So our first approach was taking that initial sample from the respondents who expressed interest from the survey and break them down by demographics. And we reached out to participants in waves. So we didn't want to just reach out to everyone right from the beginning. And so our first couple waves were focused on demographics that we wanted to talk to more, and we made sure that they were diverse demographics. So we focused on race, ethnicity, county, sexual orientation, and of course the type of crime. So those were our main focuses, and Patrick and I worked on that together. It was still a smaller sample, so after those few waves, we did end up reaching out to everyone, to give everyone an opportunity to share their story. So yeah, Patrick, is there anything else you wanted to add?
No, I think you did a pretty good job summarizing it. Just that, yeah, we did put concerted effort to recruit a diverse group of individuals, as Ali mentioned. And so I think we're pretty happy with the results overall. I think in terms of, and I think Ali can talk a little bit more about the specific stories that we heard, I think are representative of those diverse experiences, while as you talked about, pulling together into some pretty common themes overall that we're seeing statewide.
There was also a point mid interviews where we noticed, for instance, we were getting a lot of males in the beginning, and Linda and Mary and I talking, we were like, okay, well, let's focus on this week. We want more, let's reach out to more of these females, whether it's an email reminder, calling them again, etc. So yeah, Linda and Mary have been great, and we're keeping in communication of trying to get a diverse group.
One of the pieces, and Amy, thank you so much for bringing this up. It's been a constant, and it's been in the front of this whole project to make sure it's representative. But I don't know if Patrick, Adam, or Amy want to just spend a minute on how the people who participated and how this looks compared to the census of Connecticut.
Yeah, I actually, I happen to have those numbers in front of me. So those that participated in the survey, the demographic breakdown pretty closely mirrors what was reported in the American Community Survey. About 70% of our survey respondents reported their race or ethnicity as white, compared to 69% in the ACS. We had a slightly higher than ACS percentage of respondents report being Black or African American, at 12% in the survey versus 10% in the ACS. Slightly lower amounts of individuals who reported being Hispanic, at 13% in our survey versus 15% in the ACS. And we also had a slightly higher reporting rate of the a 2 or more race or some other race reporting, at 4% versus 2%. But almost across the board, the people that we talked to look like the people in Connecticut, sort of in demographic characteristics. Just because it is the way that survey research tends to run, we did talk to slightly more females than are represented in the Connecticut ACS results. That's a research trend that we've seen going back decades, that it tends to be older people and females who are most willing to complete a survey either on the phone or online. But really our demographic breakdowns are very, very reflective of the overall state population. Oh, I see a hand.
Sorry, that's me. I came into the meeting late, so excuse me if I'm asking a question that was already asked. But with the representation that exists right now, and I hear what you're saying about demographics, but there's always a lot of narrative around the fact that individuals from the BIPOC community are overrepresented. There's a disproportionality related to their level of victimization compared to how much they represent in the population. And then there's also, conversations and narrative about their voices not being as representative when it comes to victimization. So I just want to understand sort of where the pool started, like where did the group that was surveyed came from, and how representative was that group? And is that the reason why on the out end, the numbers look the way that they do? Just to kind of get a gauge for why the data is skewed in one direction.
Yeah, I think that's a great question. This was a very broad population-based survey for the online survey that the IDIs eventually pulled from. We did broad-based mailings to addresses across the state of Connecticut with follow-up phone requests to essentially Connecticut-based numbers through a sample. We also pulled some of our respondents from an online panel, which allowed us to better pinpoint people that might have those minority experiences or minority viewpoints as well. And I think Patrick can give you a little bit more info on that if you'd like.
Yeah, no, I think it's a great question. And so as Adam mentioned, the intent of the survey was really to provide a statewide perspective on crime victimization in Connecticut. However, one of the reasons why we went with a sample size of 1,200 overall, which is fairly large when you look at it combined, is able to provide those breakdowns. And that's actually one of the outputs of what we're going to produce in the analysis phase. So we have a large enough sample size that we can actually produce results broken out by these demographic populations. So we can actually look at, say, what the Black or African American population in Connecticut is saying on these very questions. And that'll be part of the analysis that we actually produce, as well as we can look at it by other demographics as well. So we can look at the LGBTQ plus population, we can look at the Hispanic population, and actually tease out what those differences are in terms of what those people are saying about their experiences. And so again, we'll provide all of that data to OVS, as well as fold that into our final comprehensive report, because I think you're right. I think, again, the experiences of those specific populations are going to be different than the state as a whole. So it was very intentionally, I think, the survey and the whole research process designed to not only be able to give us a statewide picture of what's going on, but allow us to drill down on those sort of underserved communities. And we're definitely going to be able to do that.
Oh, that's good to hear. Thank you.
Okay, any other questions or comments? I believe the next time we're meeting, Patrick and Adam and Allison, is April the 12th. And I think that we had talked about having some close to final, or at least some wrap up kind of results. Is that correct?
That does fit the current timeline, yes.
Great. Okay, so we can put that on our agenda. Any other comments? All the slides that these folks just went through were sent out on the email, so if you want to take a look at that. Also, Yvette, can you introduce yourself? Because I know you came on late, but I'm so glad to have you here.
Hi, sorry, Yvette Young. I'm the Associate Vice President of Programs and Advocacy at the Village for Families and Children, and I'm here representing human trafficking.
Thanks so much. And I don't think Mark's from OPM has come on. All right. Thank you so much, Allison and Patrick and Adam. As usual, excellent, excellent, excellent. So it just gets more and more exciting. We can't wait to hear how it all comes together, particularly from the focus group. So I appreciate that, and we'll see you in April. Thanks.
Thank you so much for your time today.
You're welcome. All right, so our next update is on Gun Violence Intervention and Prevention Advisory Committee, which Andrew Woods is chairing, who is a member of our council. So Andrew, take it away. I think your slides are up here. Yes.
I'm sorry. Are folks managing the slides on your end, or is that?
Yes, the slide is up. Yep, the introductory slide. Yep.
Fantastic. Okay. Well, great. Thanks again for the invitation to present this. Actually, this was a committee that was formed by the legislature with a sunset of January 1st of 2022, where we were charged over the course of a few months to put together a plan that will go to the state legislature on recommendations to establish principally a commission on gun violence intervention and prevention. And part of that plan was to basically also recommend best practices that this commission should consider being funded, as well as evaluations around those programs and services, as well as taking a look at the available resources in the community across the state and the nation that can actually help us address this issue. So I was chair of the committee, but also at the end of the slide, you'll see many of the other committee members that were appointed by our lawmakers. The full report is 556 pages. I've distilled it down to, at least in part, to several slides that I'll go through right now, which really only mainly speaks to some of the recommendations. And so
Andrew, you're on mute there.
You got to be kidding.
There you go. You're good. You're good.
I was talking for the last 10 minutes. All right. Okay.
No, you were fine until the last little second there. So go ahead.
Okay, gotcha. Okay, all right. So cool. Why don't we go to the next slide? And again, as I mentioned, this report, we were again established by the legislature to actually a committee that was established to take a look at exactly the kind of principally to establish a commission on gun violence intervention and prevention, make that recommendation to lawmakers, but also take a look at even philanthropic state and federal support that can support both the commission as well as some of the programs and services. And so, next slide. And so one of the things that we came up with, it was several weeks of engaging multiple stakeholders who both testified, both in person or virtually, as well as in writing. We engaged folks across the state and across the nation that help advise us on what we should consider. And as it relates to the principal question here that all of the advocates are looking for is this commission or this department that would actually coordinate these services around primarily community violence interventions. But the big question was that many of us struggled with was, or to make the recommendation, where would such a commission go? And so, folks, we took a look at, the Department of Public Health, which currently has the regulatory authority to address violence and injury prevention as being one option by which to stick or to place this Office of Violence Prevention and Intervention. But also we took a look at OPM. We took a look at, there was some consideration for judicial. And then there was some consideration for, I think, primarily those three areas with it somewhat going back to DPH or a standalone. And so what also we took into account was the fact that OPM just recently transferred $3 million or $3.5 million of the ARPA funds, the American Rescue Plan dollars, over to DPH from OPM to actually begin to seed some of these efforts. And currently that plan is in place right now to where DPH is contemplating which programs and services that they might be able to support in the next couple of years. And so that's separate from the establishment of a commission or an office. This is just principally for DPH to get some dollars out the door. But still, there will be conversations in the next several weeks or months on exactly where that department should go. We also took a look at ARPA funds being used by the governor allocated $875,000 that can also be placed to hire additional staff within DPH through the Office of Health Equity. And again, that too can give DPH some of the capacity that they might need to actually establish this office and support it. Next slide. And so the final thing here is that in relationship to DPH, it's not necessarily the final, but one other consideration is that DPH obviously is required to study the state's COVID response and make recommendations for future communicable pandemics. And so here in the state of Connecticut, among violence prevention professionals, VPPs, have been active and engaged in a lot of the intervention work. And currently we're working with DPH to actually DSS and DPH, one for DSS with the Medicaid bill to support and fund violence prevention professionals, the VPPs to actually be credentialed, if you will, or recognized by DPH, much like licensed clinical social workers and others. And so that's another tie-in there as well in terms of DPH having some role with this particular office. And then we also pointed out the fact that DMIS also can play a role. And we mentioned VOCA, we mentioned judicial as well. Again, in terms of playing a role or intersecting role with this office. Next slide. And so I'll gloss over this because I've already touched on some of the violence prevention professionals and reimbursement through Medicaid. So next slide. And then here again, the same thing. We talked about, again, standalone commission, but also what folks may not know, Linda Samino may recall this a couple of years back, actually back in 2015, there was a governor's commission on youth and urban gun violence that was established. And I think it lasted maybe around 6 months, maybe 6 to 8 months before, I like to say, before they turn the lights off. And so speaking with the governor's staff, they pretty much said, hey, look, Andrew, that commission actually is still on the books. And so rather than not folks have an appetite for that at the legislature to make that a consideration to be a vehicle by which to support this work, we'll leave that up to further discussions or watch where it goes in terms of further deliberations among our lawmakers. But that was something else that we put on the table for lawmakers to consider. Next slide. And so essentially what we had was 5 mandates by lawmakers. One was consult with community outreach organizations, victim service providers, and others to address gun violence, including researchers, etc. We took a look at some of the data. DPH did a presentation on some of the data associated with crimes and victimology and so forth. And we also heard from a variety of other different folks, as well as frontline providers, victim service organizations, stakeholders in the community, law enforcement, faith community, educators. All those folks actually we consulted with to get a sense on how they viewed the issue and what their recommendations could be. Next slide. Mandate 2 was focused on looking at best practice models and calling on the advisory committee to identify effective evidence-based programs. So principally what we have here is like when we think of best practice models somewhat here in Connecticut across the nation, there's really 3 that jumps off the charts, and that's hospital violence intervention programs, violence interrupter programs such as the Cure Violence model in Hartford, it's the Peace Builders model in New Haven, it's the Connecticut H Violence Intervention Program, Bridgeport, it's RISAP. Also, you're thinking about group violence intervention programs such as Project Longevity. Those are the 3 main ones that jump off, not only statewide, but also nationally. Obviously, there are other programs and services that will meet that threshold, but these are some of the top 3. And so our report contains exactly what these programs do and their effectiveness and the reason why we would want those organizations or those programs to be supported. But also we wanted to point out technical assistance and training that can support frontline violence intervention programs, such as the Health Alliance for Violence Intervention, that actually provides the certification and training across the nation for violence prevention professionals. We hosted a few of those trainings here in the state of Connecticut, here at this office, as well as statewide, and we got folks out of Hartford, Bridgeport, New Haven, trained and certified through the hobby. And these folks also eventually would qualify for Medicaid reimbursement when all that kicks in as well. And that's the whole plan. But also locally in Connecticut, we also launched the Brother Cow Institute, which actually provides some similar training, but this is more, again, localized. And just this past December as well, we actually trained over 36 individuals out of Hartford, Bridgeport, and New Haven that came up to the YMCA here in the north end of Hartford to also be trained through that institute. So really, again, this is about making sure we recognize these entities that can support those that want to do this work. And of course, survivor support services. When we think about mothers groups, when we think about other support service organizations, we wanted the report to reflect some of that work that's taking place across the state of Connecticut. Next slide. In the report, we talked about the coordination of these programs and that this office should consider that as well, that if we're going to be funding these programs, we want to look at exactly how are those services being coordinated, how they're being resourced, and how we're maximizing that. Trauma-informed care obviously is at the center of all this, and even place-based strategies, coordinating events, etc. There are many events that take place in the community that help foster a sense of pride, foster a sense of resiliency in the community, and culture as well. And those also need to be considered, not just evidence-based programs, but what are some of those activities, if you will, or events that actually further support families or give folks a sense of neighborhood, a sense of neighborness and everything else. So mandate number 3, next slide. Mandate number 3, we focused on strategies to align those resources. And here we basically talked about, so give an example, targeted funding, targeted and competitive state grants that can support some of these programs and services. And that's something that OVS has been engaged in. Other departments are engaged in targeted funding towards particular groups or strategies. And so the recommendation of this committee was to make sure that lawmakers understood that this was important, that not just put out competitive state grants, but also more targeted, especially if there are groups and organizations or strategies that one or a few people are implementing that has demonstrated the value in helping to both prevent and reduce and treat violent crime victims or support violent crime victims. And of course, we talked about the promising approaches, but also what are some of the policies that are also out there that can help support this work. And then we took a look at some of the currently administered grant programs federally that can also seek, like not just Medicaid, but also there's a range of different federal programs that are out there, and I'll get into that slide later on. Next slide. And so, in fact, here we are here, basically 3 and 4 were connected in terms of that last bullet. We identified state, federal, and private funding opportunities for our lawmakers to consider. American Rescue Plan, $350 billion that's been allocated across the country, municipalities, states, you name it, and counties. Executive actions by the president, $10 billion stretched out over 26 federal programs, or 5 federal agencies, 26 programs. Medicaid, congressional earmarks, we're hoping like hell that frees up and Congress can pull that off. As you know, things have been stagnated in Congress. The Build Back Better. We had a lot of hope with the $5 billion that was advocated to stick in there for community violence intervention programs would stay in the Build Back Better. Now we're concerned that Build Back Better may not ever come back or even get any traction. Of course, we all know about the Voca Fix Act, and I believe my increases there from 60 to 75% is accurate. But that's basically the bottom line, is that the Voca Fix Act is something that we want lawmakers to understand is a resource that we really are glad that Congress finally fixed that to increase that our ability to tap into those resources. And then even more dollars from the federal government over various different agencies. And then we touched on a few of the, say, philanthropic efforts in the state of Connecticut that also support some of this work. Connecticut Health Foundation has been a strong supporter of some of this work in the Hartford area as well as across the state. Dalio Foundation, Hartford Foundation for Public Giving, James and Joanne Price Fund, and there are many others, but these are some of the entities or private funders, if you will, that we wanted lawmakers to understand. They're out there as well. They're putting skin in the game. Next slide. Mandate number 5 talked about the development of a public health and community engagement strategy for the Commission on Gun Violence and Intervention. Here you have several different bullet points on what that could look like in terms of a public health strategy. Promote the process of institutionalizing prevention in the community, incorporate strength-based practices designed to empower youth, you name it, etc. Provide concrete data, strengthen the ability to track crime prevention programs. These are just a sampling of ways that we believe we need to, again, develop some community, community awareness, as well as engagement strategies to continue to support this work. Next slide. And we're getting to the conclusion of this. This here is basically the advisory committee that was appointed by our lawmakers. If you have a copy of that, you'll see the many folks that, again, they came from the major cities and some of the major agencies that actually do community violence intervention work. And so, again, from mothers groups to HVIPs, hospital violence intervention programs, the hospitals themselves, the Connecticut Hospital Association, and others. And then next slide, and I believe maybe the final slide, is these are the appointing authorities, the senators and the representatives that actually appointed each of us to serve on this committee. And again, the committee did sunset. Our charge was to get this report to them by January 1. This is the end of the presentation. This is by January 1. And now is the time where we're basically meeting with lawmakers. In fact, we have a upcoming convening with some of the lawmakers at the state capitol in the next coming weeks. There are others that are planned for us to continue to raise awareness of what's in that report and to try to, one, convince lawmakers to take into account the recommendations that we enclosed in this report. And so I'll close it at that and leave it for questions.
Any questions? Good. Is there a question out there or a comment?
Susan, Andrew, I've watched some of what was available to watch and read most of the report, and I thought it was so very comprehensive, and really learned a lot from it. And I just wanted to say congratulations to you and the committee.
Excellent work, Andrew, particularly because you've come around a lot of issues that really you've got some bite in it. It's really exciting to see how it's progressed.
Thank you both. Yeah.
All right.
So this is Mark Pelka.
Oh, yes, I saw you, Mark. Do you want to introduce yourself? Go ahead.
Oh, thank you. Well, I'm Mark Pelka from the Office of Policy and Management, Criminal Justice Policy and Planning Undersecretary, and I share Linda's esteem for Mr. Woods' work and how extensive and thorough that report was. It's stunning how quickly it came together, and observing the meetings was indicative of the high level of sophistication, intelligence, experience, but also heart and soul that was brought into this. There was a community of people seeking to save lives. And it was incredible to see it come together, and the report is a massive document. And tomorrow, the governor will propose his budget for the midterm adjustment. And as the governor announced yesterday, he will be including funding for a state community violence intervention program. And I hope that is a testament to the support to the work that Mr. Woods is doing. There will be funding in the budget to achieve many of the pursuits that were just covered in the presentation. And it's exciting to hear the discussions will be continued by the advisory committee and helping to shape this. But I think that's a signal of support as the work begins tomorrow.
Oh, fantastic. Great. Thank you.
I think it's also interesting the way the needs assessment that we just went through, the study, OVS study, and this work it's all coming together, the parallel recommendations, but also very specific to certain crimes. So it's very, very exciting. And Andrew, you did a great job. All right. Any other comments or questions? I'm going to ask Jeannie to send out again today to all the council members these presentation slides. I know they were sent out previously, but rather than digging through your email, if you haven't had a chance to see them, she can do that. They'll be available right away. All right. Linda, go ahead.
I know where time is of the essence, not that I can talk today, but I was wondering if we could ask Andrew to speak a couple of minutes on the presentation that he participated in from 12 to 1. That is, when that's available, Andrew, I would like to make it available not only to my team here, but I think the council members should see that. The first speaker, I think her name was Cynthia, was quite compelling. And really helps, again, what Susan said with the victimization survey and what you were saying with this. It's just such a perfect tie. So I know I may be putting you on the spot, but I was wondering if you could just give a couple of words about that.
Well, sure. One, it was Every Town Against Gun Violence hosted a meeting with administrators, VOCA administrators across the country to, one, hear about and learn more about how they can VOCA offices can support crime victims. And one of the young ladies, Crystal Turner, was a woman who lost 2 children to gun violence. And she spoke about, one, the experience, but also about the challenges that she and other crime survivors face while interacting and interfacing with VOCA administrators or VOCA offices to get support for their families. And so she put together a very compelling case and something for the folks to consider. My role on the call was to speak about the successes, and of our interaction with the Connecticut office. And mainly what I spoke to was the fact that Connecticut has done a great job of engaging stakeholders as well as providers and crime victims. And most recently, obviously, even putting forth one of the state's more targeted funding applications to address boys and men of color, which was a previously underserved population related to gun violence, and how that came about because of Connecticut's willingness and openness to engage along those lines and see exactly what areas could they improve upon. But also I shared about the most recent VOCA application that was the RFP that went out on how Connecticut continues to evolve in ways that we're looking at what other areas can we tie those resources to support crime victims. So give an example, most recent one talked about other crime community violence intervention programs playing a role to be able to help crime survivors. We also talked about being engaged with other coalitions and VOCA's office and willingness to make sure that those practitioners that are out here that it's okay to be involved with their partners across the state to really look at additional ways to support crime victims. But so mainly it was really about the presentation on exactly where we've come or how far we've come as a state, what our VOCA administrator and team continue to do to learn more about supporting crime victims and seeing how they can align those resources with that. And then I closed out with exactly what our program model looks like and how we actually implement our program, our HVIP program, to help and support crime victims.
Excellent. Thank you, Andrew. And I personally want to thank you because my niece was a victim of gun violence. So every time you do this, I'm like, yes, 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 just go for it. Okay. Any other questions or comments? As I said, Jeannie will send out the slides again from both those presentations. And our final presentation from on the top of the agenda is with Linda Blosey from the Connecticut Coalition Against Domestic Violence. Linda's an old friend of mine. She's been in this work for a long time, so I'm excited to hear from her today. Linda, I think you're doing your own slides, right?
Yes, I am.
Okay.
Let me just make sure that I have the right thing here. And I'm going to try to make, so I see that you have a really aggressive agenda. So I just first and foremost want to thank you for giving me some time to talk. So maybe instead of thinking about it as a kind of training / presentation, perhaps I'll give it to you today more as an infomercial. Because I know you have a big agenda. Can everybody see my screen there, though?
Yes.
So I just want to give you a little background of why it is that we're talking today about coercive control. Because in the last legislative session, we passed a new definition of domestic violence that included coercive control. And so we have been spending the greater part of the last 6 months going around to all of our key stakeholders and really just talking a little bit about coercive control, what it is, and then how it applies to the new legislation. So, Susan, if I'm going on and on, please feel free to stop me at any point, because I want to get to the rest of this. But basically, when we looked at that legislation, we thought it was more important to us to really start the conversation by talking about the concept of coercive control. And the reason for that is because generally when we look at the new legislation and its applicability to restraining orders, which I'll talk about in a few minutes, what we realized is that we have a broad concept of coercive control. And even though we have a broad concept, and for us, we've been working with, and we understand as advocates about coercive control, it doesn't necessarily mean that every single piece of our kind of quote unquote concept of coercive control applies when we talk about this new legislation. So basically, conceptually, coercive controlling behaviors are generally behaviors that are not identified as criminal acts. So a lot of times when I'm doing some presentations on understanding intimate partner violence or domestic violence, I talk about methods of control. I break them down into 5 areas, generally emotional or psychological, physical, sexual, financial, and technological. So when we look at 3 of these controlling behaviors, these are the behaviors that fall underneath the concept of coercive control. And generally, like I said, are not behaviors that rise to the level of criminal activity. So when we see these, we're talking about extreme jealousy, criticizing, blaming or punishing a survivor, invading their privacy, isolating them, which is a big factor, intimidating them, and setting rigid guidelines, oftentimes for the household or for their ways of living. We also look at it in a technological aspect, and when we look at this, some of it can rise to the level of criminal activity, but some of it does not. So tracking somebody's location, demanding check-ins from them is something that we would consider to be coercive in nature. Excessive texting, using spyware and monitoring devices, and monitoring people's communications as well, all fall under the concept of coercive control. And then lastly, in a big picture, and I think the one that oftentimes we see most often, along with the technological abuse, is the financial abuse, withholding money, denying access to bank accounts, ATMs, and credit cards, ruining a victim or survivor's credit, taking their paycheck, showing up at a victim or survivor's workplace incessantly, calling them using the business line. And that actually also goes along not just to the workplace, but if somebody is attempting to become further educated, kind of thwarting their efforts for further education, insisting that the victim be driven to work. All of these things, while we wouldn't necessarily always see these as criminal activities, more oftentimes in your coercive controlling relationships, this is what we see. I had a quick conversation with Susan on this previous to us starting the meeting today. And the challenges for this are oftentimes that, well, first and foremost is that coercive controlling language isn't in a lot of states. And I will get to that after I finish this concept piece. So the difference, when I talk about coercive control, I would say versus, say, any other sexual or physical violence, I want to explain it in this way. Number one, it's not just psychological. As you can see, what I have here is it's very calculated, it's very intentional, and it's very premeditated. Now, I want to make a distinction in this case. So oftentimes when I've been doing domestic violence work for a long period of time, and I have been thinking about distinguishing coercive control versus other types of controlling behavior. So I want to kind of give you a quick example of this. Oftentimes in a physical assault, when we see physical assaultive behavior, that behavior isn't necessarily premeditated. In other words, for example, if I'm in a relationship, and I'll use Susan since I know her. If I'm in a relationship with Susan and I, as the abusive partner, I have certain expectations of what's going to happen when I come home from work. That expectation may be that there's dinner on the table, that, I have cold beer, and I'm using this kind of very simplistically. When I get home, if all of those things are in place, I'm not going to assault my partner. So I'm not on my way driving home thinking about, regardless of what goes on, regardless of what I find when I get home, I'm going to assault my partner. My assaultive behavior, while inexcusable, is in regard to what I have found. I haven't premeditated that. I use it, the only premeditation that I would say is it's in my range of behaviors that I find that I can use to gain control. But like I said, it's not something that I premeditated when I went home and I said, regardless of this, I'm going to do this. When we see coercive controlling behaviors, those are behaviors that are very premeditated. They're well thought out, they're intentional, and they're calculated. And the difference between the other behaviors, controlling behaviors, is that when we look at these behaviors, the most distinguishing feature is that what it does is it places the victim or the survivor in a state of entrapment. So, for example, regardless of where I go, my whereabouts are going to be monitored. Okay, my partner may say something to me like, when you get to Stop and Shop, for example, I want you to take a picture of where you are so I know that you're there. I'm the owner of the cell phone plan. As the abusive partner, I'm the owner of the cell phone plan, so I can consistently know by just logging on to my cell phone plan online where my partner is. I can GPS track him or her. I have rigid guidelines about how the household should be run. I run all the finances. I give limited finances. And so what happens is for that individual who's experiencing that coercive control, that individual's world gets smaller and smaller, and they literally are trapped in that relationship. Because they're trapped in that relationship, because they're in that state of entrapment, what happens oftentimes is it really diminishes a survivor's ability to exercise autonomy and personal agency, which are the very things that they would need to do to leave that relationship. So it's a very different, it's a very, very different type of controlling behavior that we see. And oftentimes it's very difficult to, I would say it's very difficult to describe. As I mentioned, it's qualitatively different. And it really is based upon multiple tactics that we see, like isolation and control. And when we see the physical violence, as I mentioned to you before, that may be, we may see that as a single incident, yet with the coercive control, it is behavior that are never ending, and they're really entwined into every moment of every day for an individual. The distinguishing factor and the challenges in terms of describing coercive control are these types of things. When we look at a healthy relationship, there are no coercive controlling behaviors. Generally, we look at independent autonomy for both people. And sometimes, and I think we're going to see this when we start to look at more applications for restraining orders, is that oftentimes the behaviors that survivors are going to describe can be rationalized by that abusive partner. So say, for example, I might say that my partner was stalking me outside of a restaurant. I may say, well, I just wanted to make sure that she got there safely, or he got there safely. May say, my partner, a survivor may say, I have to check in with my partner at all times. And the abusive partner may say, well, I like to check in with her or him as well, because I just want to make sure, like, if one of us is going out, we have childcare or whatever we need. So a lot of the behaviors that people will describe can oftentimes be rationalized in another way that looks like I'm trying to keep my partner safe, or I just want to make sure that we both know what's going on in the relationship, where actually in a healthy relationship that would be normal. When we look at these types of relationships, they're extremely controlling in that way. So what we look at nowadays is when we're looking at coercive control, if there's no physical violence or any of these types of behaviors present, invading somebody's privacy. And basically, when I talk about that, I'm talking about non-consensual monitoring of somebody's technological devices, whether it be their cell phone, their email, their laptop, any of those things, isolating that victim from seeing other people, intimidating them, setting rigid guidelines. And then we start to see some that border on your criminal behavior, which would be sexual coercion. But then we'll see threatening to reveal somebody's sexual orientation, sexual images, tracking their location, demanding check-ins, monitoring their communications. And you can read on and on here, withholding money, and then no access, as I mentioned to you before. Now, why this is important is because, as I mentioned to you when I started this, we have some new statutory definitions. And so when Public Act 21-78 passed or was put into law, what it did was it amended and it established the following definitions. It amended the definition of domestic violence, and when it did, it created a definition of coercive control. So I'm talking to you right now, just when we talked about the concept of coercive control, kind of as a broad-based concept. When we look at the new statutory definition of domestic violence, we still see the first three pieces, which are a continuous threat of present physical danger or physical injury, a stalking, or a pattern of threatening. But now what they added to that was coercive control of such family or household member. When they did that, when the legislature did that, what they did have to do, because they added coercive control, was they had to define it. And so statutorily, what we're seeing now is this. Coercive control is now identified as a pattern of behavior that includes, but is not limited to, unreasonably engaging in any of the following: isolating the family or household member, depriving the family or household member of basic necessities, controlling, regulating, or monitoring the family or household member's movements, their communication, their daily behavior, their finances, their economic resources, or their access to services, which is what I have been talking about previous to this. In addition, it also defines coercive control as a compelling the family or household member by force, threat, or intimidation. And this is a little awkward in the way that in which it was written, but the force, threat, or intimidation can also include threats based upon somebody's immigration, but compelling them to engage in conduct from which they have the right to abstain from, or compelling them to abstain from conduct in such that such family or household member has a right to pursue. And then lastly, what we're seeing is also coercive control also includes committing or threatening to commit cruelty to animals, and of course, forcing sex acts, which in and of itself are is criminal activity as well. So now what's happening now, because of that, because we changed the definition of domestic violence to include coercive control, the whole definition of coercive control can now be used as an eligibility criteria in an application for a restraining order. Now, what happened is we updated the definition of victim of domestic violence. Now it extends itself to coercive control. Now, I just want to say a couple of things about that kind of in general. So we've been spending a lot of time with all of our key stakeholders, providing a lot more. Like I said, this is more of an infomercial than an actual training, but really helping people to understand the concept of coercive control and what they're going to see from a civil justice perspective. I think, from an OVS advisory committee perspective is some of the challenges for people who are going to seek an application for a restraining order based upon coercive control is that there's no actual civil remedy to tell somebody not to be controlling. So even though we've changed the application and people can use coercive control as an eligibility criteria, we still have the same remedies when we talk about what the court can actually order. The court can actually still order, excuse me, do not threaten, harass, physically or sexually assault or stalk their partner. So just kind of as an update, what we have been spending some time right now is at CCADV is trying to think about how we can tie coercive control into the civil remedies that a court can order as well. So how do we wrap those coercive control behaviors around the provisions that the court, around the remedies that the court can currently move forward with in that way? So that's my quick infomercial. Just to, to let you know where we're kind of, what we're at and what we're doing with this. I mean, if anybody here wants a lengthier presentation, we're happy to do that. You just have to contact Jerry or contact myself at training@ctcadv.org.
Okay, it sounds like this is a topic that we would like to have come back to us, because we have been talking about restraining orders over the years and the remedy. I had never thought about that, Linda. As a lawyer, I'm like, yeah, you're right. What is the remedy for like, don't do that anymore kind of thing? And so maybe that's information that can come back around. I think you mentioned this to me, but maybe not to the group. We are only one of 3 states that have this new statute in place, so we don't have a lot of, even in other states, experiences, right?
Yeah, so what's happened is that we have actually, we've had to reach out to some of our allies across the pond in the UK, because we are only the 3rd state in this country, preceded by California and Hawaii, who have codified coercive control in some capacity. And even with that, they're only probably 6 months ahead of the game than we are. So I think that, right now what we're looking at is, what are we seeing? We have an interest at CCADV in trying to understand what are we seeing when people are making applications for restraining orders, claiming coercive control. And but I think we're very much interested in also understanding what are the challenges for judges and for the court itself in trying to assist a person when we only have so many remedies as well. I kind of try to say this, it's kind of like, yes, you can mandate a person not to physically or sexually assault somebody, but how do you mandate somebody not to be controlling when they spent the last 15 years of their life being controlling? I mean, number one, we don't have that provision for it, but even if we had that, how do we feasibly do that, I guess I would say.
All right, I'm going to take the privilege of the co-chair and just say we need to keep this on the agenda, and I'd love to have Jerry and you think about how it might come back around and begin to answer some of those questions, and also get some feedback from the the council members. Is there anybody who has a burning thing they want to say? And we're a little bit short of time, but I want to make sure we can do that.
Hi, Susan. This is Irene Michael. I'd like to just make a quick comment. First of all, hat tip to you, Linda, for this very well done presentation. When I read through the material, the thing that came to mind, of course, is gaslighting. And that's the psychological manipulation of a person that caused them to question their own sanity. And I thought of a hellacious incident that came to light back in November, early November of 2021. It came from East Haven, and it involved a man whose spouse, over the course of some 20 years, convinced him that he was mentally impaired. Ultimately, she convinced him that he had Alzheimer's, and she managed to steal something like $600,000 over the years. Just a horrific case. The story was so horrible, it even appeared in the Washington Post. So, it was the big time. This is really a huge area. It hasn't been addressed. And hat tip to CCADV for taking it on. And I'm very interested in learning more about what you intend to do with this.
Yeah, and so thanks. So thank you. I guess what we're finding right now is that really we don't have enough information to be able to, it's only been in effect since, they made the changes to the law on July 1st, but they didn't make the changes to the restraining order application piece until October 1st. And so it's still all very new to us. But I think that, we would be happy to come back and, just talk about what we're seeing and just try to give people kind of some up-to-date information on kind of where we are with any successes and challenges in, implementing this type of a piece of legislation. And I know it's not just on us, ultimately, a lot of you folks in this room today are going to be working and hearing these concepts as well. So I'm kind of looking forward to working with everybody as we kind of try to push this forward and then, try to bring whatever information or, if you're having challenges or anything, or, regardless of what your status is or, what your discipline is there, I'm just all ears on anything that anybody would have to say about this. So thank you so much.
You're welcome. And thank you for that very broad invitation. All right, I'm going to turn the meeting over to my co-chair, Judge Baldini, to move us through the last part of this agenda. Thank you so much to all the presenters.
All right, thank you, Susan. And again, good afternoon, everyone. And many thanks to those who prepared the presentations that we had this afternoon. We appear to be on track. Let's try to stay on track. The next agenda item is the OVS report, which will be presented by OVS staff. So we have the Criminal Injuries Compensation Fund report and OVS update.
Okay, well, I'll get started with the Criminal Injuries Compensation update. We passed out the budget statement for January 31st. Through the end of January, we spent $1.6 million out of the compensation fund for reimbursements for expenses. This is about $360,000 higher than what we spent through January of 2021. That reflects the increase in claims that have been coming into the office over the past year. We do have sufficient state and federal funding to cover those expenses. As Andrew mentioned, with the VOCA Fix Act, our compensation grant reimbursements are going up, so we have additional federal money to cover those expenses along with what's in the CICF. So we will be good for this year for what we're paying out of the fund. If there aren't any questions, the other update we have is on the court revenues for deposits into the Criminal Injuries Compensation Fund. Through the end of December, we've received $583,000. It's $204,000 higher than December of 2020. And at halfway through the year, we've already received 80% of prior court collections. So the court activity increases and the revenues continue to go up. Overall revenues into the fund through the end of January are $464,000 higher than last year. So while the expenses are going up, the revenues are going up to keep pace with them. So hopefully that trend will continue.
Great.
Great. Does anyone have any questions about those reports? Thank you. Hearing none, I think we can thank you for those reports. That's some encouraging news. We'll move to agenda item 7.
Judge,
yes.
Judge, I'm sorry. I'd like to, if Mary and I are prepared to give an update on 6B.
My apologies.
That's okay. No worries. Thank you, though. I just very quickly, and to pick up with what Jim just said about the expenses in compensation for calendar year 2021, we entered 1,979 applications, which was a 43-year high, and we've been in business 43 years. Of that number, 1,272 were for personal injury claims, 152 were survivor benefit claims, and 555 were emotional injury claims. Again, it's easy to say that it was the highest in our existence, but because of the legislative changes that took effect in 2018, our highest year of applications was 2018, and the legislative changes went in 2017, sorry. So in 2018, we had 1,695. So in the middle of the pandemic, when folks are saying that crime is down, we received 284 additional applications last year. And we are on track again this year. We are, I think, 12% higher, maybe 10% higher in applications received in January as opposed to January of 2021. So we are, people are finding us, people are relying on us. And again, I think with added work with Andrew and in the survey, these numbers will continue to tick up. Quickly, I have 2 other things before I turn it over to Mary. Our sexual assault forensic examiner program, we've just compiled a list of everyone that we have trained over the course of our training program, and there are actually over 100 medical providers in the state of Connecticut who have been trained by us and who have maintained their training by annual competency days every 3 years to keep their certificate up. So although we're not statewide, we are certainly having an influence on the standard of care for patients who report sexual assault. Our next class starts on April 12th. We worked in combination or collaboration with a colleague who sent out an email blast through the Connecticut League of Nursing. And because of that, we now have 13 individuals who have applied and been accepted into the training program for this coming spring, which is because of, and I've mentioned this at these meetings before, because of the pandemic, we are down 50%. We had something like 26 safes on the calendar a year ago, and now we're down to 16. So our response rate to hospitals is greatly diminished. These 13 individuals coming into the program, actually, it's a boost for morale and a light at the end of the tunnel. And the other piece that we're hoping to not only create awareness in hospitals, but we've been working very closely with the Connecticut Hospital Association. And beginning on the 22nd of this month, we will be starting 3-hour classes for nurses to participate and understand the elements of a kit it's not a hands-on, it's not our class, but it's really to demystify the steps of the kit. And then we're doing a similar class, but 2 hours in length for providers. So we're very, very happy about really getting this word out and getting more people into the program. And based on time, I'm going to skip I'll give a more thorough update on the changes in our leadership structure at our April meeting, if that's okay, Judge. And then I'll turn it over to Mary.
Thank you, Linda. Good afternoon again, everyone. I just wanted to give a brief update on the Victim Services Unit and our new team members. We've had 9 recent hires over the last several months, and we engaged in over 100 hours of classroom training supported by courtroom observations over the last 7 weeks. And we provided that training to our recent hires. In addition, we had 2 staff that transferred from the helpline to court-based positions and included them in that training, as well as opening the training as an opportunity to revisit any training topics to all of our team members. The training was provided by a combination of internal and external presenters, including our team of supervisors, our new trainer in our training and outreach unit, managers of our OVS units, and a collaboration with a multitude of community and criminal justice system colleagues. So we're very grateful to everyone who assisted us with that. And we concluded that classroom training yesterday. So all of our team members are making their way out into the courts and our 2 new team members here at the helpline to begin the provision of services to crime victims across the state. Thank you.
All right. Thank you for those great reports. Any questions? Okay, Mark, it looks like you have a question.
Sorry, Judge, and I was probably lowering and raising again, and it's not because I was being emphatic. It's because it was a delay in the turning on. So forgive me. I'm trying to behave. I wanted to if I heard Linda correctly, that is a very creative way to broaden the training for medical professionals with SAFE, because I've seen medical professionals be overwhelmed when confronting the kit, when working with a survivor. It can seem the number of steps involved and the components and the sense that it's being submitted to law enforcement can be intimidating to someone working an overnight shift in an ER. What a great way to help support survivors as well as medical professionals who aren't going the whole way toward becoming a SAFE certified nurse, but recognized in the absence of one would need to carry out a kit on their own. That's very creative. Yesterday, when at the preview that the governor did of his public safety components of his budget, he also addressed the issue of the disappearing federal funding for VOCA assistance to states and the impact that's having across the country and in Connecticut. And the governor announced that in the budget that he'll be introducing tomorrow, it will include $14.7 million in ARPA dollars to offset the cuts to fill the gap in 2023 to VOCA assistance to Connecticut. This was one of the items that the judicial branch submitted on behalf of the Office of Victim Services, and that will be in the budget tomorrow. And I hope that provides some relief, recognizing there are further effort and discussion and review to come. But at the beginning of the session, that was a priority item in ensuring that victim services are not cut during a time of such urgent need. So more details will be in the budget documents tomorrow. Because that was included in the press release and the event yesterday, I wanted to share with the group.
Right, thank you for that. Any response? I see we have another hand up.
Yep. Hi. Sorry, it's Jessica. Mary and Linda. I just wanted to say it's been a real pleasure to meet all the new staff that have come on board. I've spoken with a variety of the new advocates, and they're absolutely wonderful. And Sue and I are very, very eager to start working with them in the future. So I just wanted to say thank you. You guys are doing such a great job. You have such a passionate group of people.
Thanks so much, Jessica.
Thank you. Any other questions, comments? So we have on our agenda next roundtable discussions, and these are things that had been brought up at prior meetings. that people had expressed interest in kind of meeting to discuss certain issues in greater detail. Does anyone want to jump in and sort of discuss anything that's come up since our last meeting with regard to this?
I think we're particularly looking for any legislative proposals that are that may be on the table that we haven't already talked about in the meeting.
Right. And also we have on the agenda in any issues, and we've kind of hopefully crossed the hurdle with COVID, and that seems to be, the numbers seem to be coming down. Any issues with regard to COVID and victim service delivery?
Yeah, just a quick announcement on that piece. I know tomorrow our staff will be going out with the Deputy Commissioner of DPH to actually in the north end of Hartford to actually disseminate COVID information as well as trauma information and information on how victims of violent crime in the north end of Hartford, if they are in need of services as victim of violent crime survivors. But mainly it's around raising awareness, using that opportunity to distribute COVID the testing kits, as well as masks and the victim of violent crime information on how families can connect with us if they have needs. So again, that's going to take place tomorrow, and our staff has been engaged with some of that work with the governor's office and DPH for a little while now.
Right, and since our last meeting, there have been opportunities to get the COVID-19 test kits. People can sign up to get test kits online, things of that nature, making testing more accessible to people, which is certainly encouraging. Anything else from any of the other council members?
I will also say, just to reiterate what Andrew's saying, shortly we have started a concentrated effort also to make sure that through our member organizations, we're getting test kits out there. We're working with DPH for vaccinations and really trying to provide a lot of masks, personal protective equipment, kind of along the same lines of what you're doing, Andrew, as well, hoping to reach out to survivors that we work with and underserved populations as well.
All right, so we are at the new business. Is there any new business things that people want to talk about or kind of put out there for maybe future meetings, or thoughts that you have about things that we should be discussing as a council? We've put a lot out there today, so and we've spoken about a lot of things, which will certainly give us a lot of things to consider between now and our next meeting, which I have on our schedule as being April 12th. That's also going to be on Microsoft Teams, same time, 2 o'clock. If you have the agenda, it has the next two meetings, which are that April 12th date as well as the June 14th date. But anything you want to throw out there before we kind of move to our next step, which I think we've done a Herculean effort this afternoon, getting the things done that we did, and kudos to everyone for presenting everything in such a concise way.
So this is the period of the agenda I like to think about as co-chair and with Judge Baldini, what people like on the next agenda. So what I've been collecting so far would be the final report, pretty much of the needs assessment, OVS needs assessment, which we've been doing. We'll be in the middle of a legislative session. Are we short session, long session? Yep. So people would we always have this on the agenda, but legislative issues, what people are, proposals that are out there, where things are, if people need some help on a particular issue. And also just thinking about not only state legislation, but also federal legislation. I think we covered a lot of that in the presentations today, particularly because a lot of the funding is now merging between the federal and state money. And any other presentation, anybody, anything? Remember, we encourage people on the council to bring reports or topics to us, like Linda Blosey did today from CCADV. So anything that's going on, you don't have to say it now, but if something comes up, something that you feel would be great to share across this multidisciplinary group and get some information out there. All right, so that's the agenda so far. Anything else that pops up for April? Sounds good. And we're 15 minutes early, so I don't know what that means, except we did a really good job.
So, motion to adjourn.
Oh, so sorry, Madam Chair. Sorry.
Okay. So a
Sorry, this is
second.
Mark.
Mark, did you want to say something before
I'm
we?
so sorry. Given that
It's
there was
okay.
time, I was really trying to limit. But I thought Linda's presentation was just superb. Multiple Lindas for CCADV on coercive control, and what I was thinking about how coercive control is applied in the current social settings that we're operating in. I think the term used so long has been pandemic impacts, and it's spoken about isolation, about quarantining, about social distancing, and the impact that has on victims and survivors and other vulnerable populations. I'm wondering if, listening to the presentation made me think about the longer term view that we have of society as we move forward through these phases of the pandemic, coming out of the latest Omicron period. How is society changing, and what are the long-term increased challenges, heightened difficulty that victims and survivors will have? What are the new vulnerabilities that we have as society changes, as pandemic of all sorts have on us? And how do we be ahead of the curve to better support and protect victims and survivors who are vulnerable in these settings? The coercive control presentation was especially spot on because she helped to explain to in the presentation how the perpetrator utilizes various opportunities and stratagems to exercise control. And maybe as we move forward, even if we're past the Omicron phase and moving into the next phase, what are the long-term challenges and risks that victims and survivors face? So that may just be a topic, Madam Chair, for general discussion, but it's something that I've been pondering about, and I might come forward with, more clearly defined ask at the next meeting, but I thought it might be something at least worth thinking about.
So I just want to comment on that. And so thank you, number one, for your kind words. But I know that, we're going to continue to do some training around the issue of coercive control, especially because what we have been finding is, number one, two things. Through some of our work, and I'm not sure if Jerry mentioned this before, but especially when people were sheltering in place, we were getting numbers of calls for people that were not necessarily unsafe at that particular time, but being re-traumatized by the isolation that they were feeling due to COVID-19. And so we are going to start the process of preparing some trainings around the traumatic impact of COVID-19 on survivors of intimate partner violence and domestic violence, because and especially not just for adults but for children as well. What they might have been exposed to, having forced to remain in the household with no kind of eyes on them, I guess I would say.
Yeah, and I think the other thing Linda and her team will be thinking about, I'm assuming, and we can talk about this in April, is I'm not surprised by most of the findings in the needs assessment that have come out so far, but I've been doing this work for many years, so it didn't surprise me. But I think it's also, as Mark's saying, put it in another context. Those are things we've known along the way, and we've made some improvements, but now we're in a total different world. So how those findings, which seem now to have so much more weight to them, I guess is the word, and documented. We've got people's, conversations. We've got focus groups. I don't know that anybody can deny it anymore. The only question is, as Andrew has done so well in his topic, how do we put this all together and manage the money and the funding and the programs that are already in place and the ones that are desperately missing? and to have a commitment by our community, the state's community, government and private, public and private, to do something about this. I'd like to have that happen before my time is over, but I don't know. Not that I haven't seen a lot of progress over the 40 years I've worked, but boy, this is an opportunity upon an opportunity. So, and that's why Linda's going to stay with us for a little while longer. Yeah, and we're all going to clap about that. Yay! All right. We did good today. I'm very impressed, and there's a lot of information, but please process it and let us know if there's any piece of it that we can bring to this group that would move it around the circle much, much faster.
Okay, dare I ask for a motion to adjourn?
I think you can.
Okay, motion?
So moved.
Okay, second?
Second.
All right, all in favor?
Aye.
Aye.
Thank you very much for being here this afternoon, and we look forward to seeing you in April. We'll stand adjourned. It's 3:48 p.m.